Without further ado, I'd like to introduce everyone to Penny's Executive Director, Devin Trolley. I'm going to go ahead and share our presentation deck. And if you would, Executive Director Trolley, please take it away.
Thank you, Scott, and thank you everyone for being on this morning so we can talk through some important information about Pennie, and also hope everyone is enjoying their holiday season. I know it's a busy time for everyone, both with the holidays and with all of the coverage deadlines, at least on the Pennie side, that are coming up. So just going to be talking through a little bit of some background on Pennie for anyone who is maybe less familiar, and a little bit of a refresher for those who are, and then also highlighting some important timelines and key information for this time in particular, which is open enrollment. All right, so what is Pennie? As many of you might know, Pennie started with the 2021 coverage year, where the health insurance marketplace in Pennsylvania was shifted to be run by Pennsylvanians here in the state, instead of through healthcare.gov, which was the federal government marketplace for Pennsylvania. So since then, it's been Pennie, and that's how people can get coverage especially if they don't qualify for Medicaid based on income. This is where people can come where Pennie picks up to get coverage if they don't have it from other sources. So since we launched, we've been able to offer lower costs, more plan options, and we are lucky to say that we've had much better coordination and been able to have much better coordination with the Medicaid program here in Pennsylvania to make sure that that process is as smooth as possible. And we'll talk a little bit more about that in a bit. So our goal is to make sure that people, in particular Pennsylvanians, have access to affordable quality health coverage. And we try to make sure that consumers have all the information they need to make those health plan decisions. So we do have health insurance plans from a wide variety of health insurance companies throughout Pennsylvania, but we are the only way for people to get financial savings to reduce the cost of that coverage and care. We are really for anyone who doesn't have coverage through their job or through medical assistance or CHIP, and really for anyone who doesn't have health insurance. As many of you may be well aware, we have a no wrong door policy where if people apply to Pennie where they really qualify for Medicaid or CHIP, we transfer them over automatically. And of course, Medicaid and CHIP automatically transfer them over to us as well. So we know we've done a lot of work over the past couple of years since Pennie started to make that process even smoother. And I think that's one of the great benefits of having a marketplace based in Pennsylvania, is that we're able to make some of those changes for Pennsylvanians. So as of the end of last open enrollment, we had about 370 Pennsylvanians enrolled in Pennie coverage, and 90% of those get financial assistance. And so we'll talk a little bit more about what type of financial assistance Pennie provides. So as I mentioned, it's the only place to get cost savings on quality health coverage. There's really two forms of cost savings that Pennie has. One is a tax credit. It's an on-the-spot tax credit, not one that you have to wait for tax time. It happens right away for those monthly costs called premiums that people would need to pay for private coverage. And this is based on income. And so for someone, for example, who makes just a little bit too much for Medicaid, we often see people in that boat paying $0 for a health plan. As you go up on income, the amount that people contribute to their premiums increases. So that's a really important point that we try to convey to our consumers, and that might be really helpful for all of you to know as well, is that especially if you're just a little bit higher than Medicaid, you can get really, really low cost health plans through Pennie. So we have some stats later on about what we've been seeing specifically during the unwinding period, but we've really seen it be affordable for a lot of people. Again, sometimes $0 or $1 or under $10 a month for people who are coming over from Medicaid. No one pays more than 8.5% of their income. But again, people with lower incomes are paying more like 0% or 1% or 2% is where it's capped. I will say too that, it is based on income, and our eligibility is intended to pick up where Medicaid leaves off, but it is calculated a little bit differently. So instead of looking at current monthly income, Pennie coverage and financial help is really based on projected income. So what we ask people to provide is what they think they're going to have as a total income for 2024, for example. And that's what we base the financial savings and the tax credits on. So just wanted to call out that's a little bit different from how the income is calculated on the Medicaid side. And I know we've tried to make that as smooth of a process as possible to minimize any um, any complexities from that different calculation, but did want to highlight that. We also have another type of cost savings called cost sharing reductions. And this is really for, again, based on income, but for people when they actually go to the doctor for that copay, for the deductibles, it lowers all of those to make it so that people don't just have coverage, but they can actually use the coverage and find it, possible to use that coverage. So this is something that we find people, particularly those coming over from Medicaid or who are no longer eligible for Medicaid, are often, I would say, put off by the deductibles or the copays. That is a feature of private health insurance. So those do exist with Pennie health plans, but I will say at the lower incomes, those are significantly reduced. So again, based on income, if someone makes just a little bit too much for Medicaid, those copays and deductibles are much, much lower. And some of those costs go away completely with some of the cost sharing reductions. Wanted to highlight that. And then here's some examples of what people are paying. Again, what people pay is based on income. And for comparison, if you look at private plans that are not through Pennie, you could be looking at $400 or $500 a month. And in comparison to that, what people are actually paying is much less than that. So we have about 15% paying less than $1 a month, and that number is even higher. It's closer to 25% for people who are coming over from Medicaid during the unwinding that are paying $1 a month for coverage. Nearly 30% are paying less than $1 a day, and 40% are paying less than $80 a month. Again, for people that are coming right over from Medicaid who've recently lost eligibility, we are seeing affordability be even more so for that population. So you would see these numbers go up if you're just looking at the Medicaid group or people who recently had Medicaid. But these numbers are for all Pennie enrollees. And so also wanted to talk a little bit about how the insurance through Pennie is high quality. So sometimes, we do hear from people who are unsure of how to go look at private health insurance, especially if they've been on Medicaid for a while, that there are concerns around, what it covers, and maybe they've had bad experiences in the past where the coverage doesn't cover something that they thought it would. And that is actually one of the main reasons to come to Pennie instead of trying to get coverage outside of Pennie, is that we guarantee that all the health plans that we have available through our program cover the full set of benefits, cover care for pre-existing conditions, and have important financial protections for consumers. So if you look some plans outside the Pennie marketplace or even before the Affordable Care Act, sometimes what would happen is that health plans would limit what they pay and consumers would have to pay the rest if they had a major medical issue. Well, it's reversed now with plans through Pennie. What is limited is how much a person would have to pay in a year, and then the health plans have to pay the rest. So it's really a lot more financial protection than has really been in place in the past, and also compared to plans outside of Pennie, they don't necessarily have those protections. Here are some of the essential health benefits listed out that all health plans must cover. So you see things here like emergency care, hospitalization, maternity and newborn care, mental health and substance use disorder treatment, prescription drugs, lab services, and pediatric services. Another one to highlight here is that preventive and wellness services category, because many of the screenings and vaccines and other certain preventive services are free. So sometimes people, are concerned that, getting a vaccine or something like that would have to be, paid for. But a lot of that allows people who have coverage and maybe don't have health conditions necessarily, but want to get ahead of them by getting vaccinations or getting those wellness screenings like mammograms and colonoscopies. All of those are covered at no cost to consumers if they have a health plan through Pennie. So that's an important one to highlight as well. So talk a little bit about how to enroll, to the extent that just in a sort of a high level to if you ever get questions or are in a position to provide information to someone who's thinking that they might qualify or interested in exploring what options they would have through Pennie if they don't qualify for Medicaid. And the one thing I really want to highlight is there's a very quick tool on our website, which is pennie.com, pennie.com, that people can use just to get a quick look at what savings they would qualify for and what health plans are in their area. So all they have to do is go to the savings calculator at Pennie, enter in a zip code, how many people are in the family, and what the household income is. And they'll right away get an estimate of what their financial savings would be and be able to browse plans in their area with those savings incorporated. Once they see that, if they see a plan they like and are ready to enroll, then they would need to apply, which really what they're doing is applying for that financial help. So providing information about citizenship, any eligible immigration status, documentation they have, household members, and income. Very similar, actually, it's designed to be, in essence, the same application that people use to apply for Medicaid, the single streamlined application. So, and that really allows us to do that transfer back and forth seamlessly with Medicaid and CHIP. So once they've done that and have submitted that application, then they get to shop and go back and find that plan that they saw in the preview step, enroll in that. And then one thing we always make sure that that people know about is that they do have to typically pay a premium every month. That is something that sometimes people, when they come over from Medicaid, aren't used to doing. So it's something we like to make sure that they're aware of. Again, sometimes that premium is $1, $5, $10, but they do have to pay that. If they don't, then their coverage will not take effect and will not stay in effect. So that part's really important. And then once all that's done, they are covered and they have the peace of mind that comes with having coverage. So the when you can enroll is really important right now. This is another difference between Medicaid, the Medicaid program, and the marketplace, and that we have open enrollment, which is the one time of year for people to enroll in coverage for next year. So we don't take applications all year round, or people cannot enroll all year round unless they have a qualifying life event outside of open enrollment. But besides that, open enrollment is really the only time of year that people can apply to enroll for next year. So that started November 1st, and it goes until January 15th. But there are important deadlines before that. So this Friday, December 15th, is an important deadline because that's when people have to enroll by in order to be covered on New Year's Day. If they wait until after that, their coverage won't take effect until February 1st. And we're always worried about coverage gaps for people. So we always try to make sure that everyone knows that that date for January 1st coverage is December 15th. So particularly if you're talking to anyone or working with anyone this week, especially, try to make sure that they know that that's an important deadline and to enroll quickly. And then, I think one thing that we always also try to convey to people are the risks of going uninsured. Sometimes people focus on the costs of insurance, but there are costs of not having coverage as well. So people don't have financial protection in the case of illness or injury. It can cause medical debt or bankruptcy with, getting in a car accident or rolling an ankle, all those things that you can't predict and you never know when they're going to happen. Health coverage really provides the protection against that. If people don't have coverage, they don't have access to those free preventive care services that can catch small issues before they become larger ones. They wouldn't have access to ongoing treatment for serious illnesses like cancer or diabetes, and they don't have that peace of mind. So to the extent that you're talking to or working with anyone who no longer qualifies for Medicaid and really isn't sure about whether to take the steps to enroll in Pennie, these are really important points to make, just that there are costs to not having coverage. And when you look at the financial help that's available to lower the cost of those health plans, that's when it's really important just to go use that quick tool to see what each person would actually pay, to see how much financial help is available. So we have been working very closely with the Medicaid team and you all for the past several months, particularly as the unwinding has been happening. So one thing just to, in case, as a refresher, or in case you haven't heard it before, we do a lot of steps on our side when someone no longer qualifies for Medicaid to try to make that process as smooth as possible for people. So when we get an application from Medicaid where someone is no longer eligible because of income, the application will automatically be sent to Pennie, and we send a letter to that person to say, here's how you come and get the account that we already created for you. We already fill out the application so they don't have to put all the information in again. Again, because the applications are the same, we're able just to put that information right in. And in many cases, we're able to tell someone right in that first letter how much financial help they're eligible for. There are important deadlines with losing Medicaid coverage. So people need to, open enrollment, anyone can come in and enroll, which is great. But outside of open enrollment, one of the biggest reasons that people can still enroll, even if it's not open enrollment, is if they lose other coverage. So if they no longer qualify for Medicaid and they're losing that coverage, they can enroll through Pennie, even if it's not the open enrollment period, but there are deadlines for doing that. We really encourage anyone in that situation to enroll within 60 days of losing of the Medicaid end date. And that's because if they enroll within those 60 days, we're able to have our coverage start right after the Medicaid coverage ends. So there's no gap in coverage. We do have a longer enrollment period. It actually does go for an extra 2 months after that. For people to come in and enroll through Pennie. That's only during unwinding, so that will shorten after the unwinding when we get back to sort of more regular business. But also that means that the coverage would be moving forward. So if they wait 3 months, their coverage wouldn't start until month 4, and they really have a big coverage gap. Again, we try to do as much work as possible to avoid coverage gaps for anyone. So that 60-day window is really the important one that we emphasize. And so here are some more stats, and actually these are updated a little bit. So we've enrolled over 30,000 individuals since the unwinding started. So that number's jumped up a bit in the past couple of months, and half pay less than $50 a month. And we've actually seen it to be 1 in 4 pay less than $1 a month. So it's about 25% now. So I'll have to update this slide, but as you can see, we're getting, as more people are coming in, we're seeing it be very, very affordable for people to get that coverage. And that's more affordable than general enrollees through Pennie, just because of what the incomes tend to be for people who have recently lost Medicaid or recently not qualified for Medicaid. So anyone who is not qualifying for Medicaid during open enrollment, they kind of have they have lots of opportunities to enroll, but we do emphasize to them to enroll in both the 2023 and 2024 plan. This is a difference again with Medicaid in that all of our coverage is based on a calendar year. So sometimes that takes people, if they've been on Medicaid for a while, sometimes takes them a little bit of time to get used to that they have to, enroll for 2023, and then they also have to make sure they're enrolled for January 1st of 2024 for that whole coverage year. So that's something that we like to make sure we spend extra time with anyone who's coming over from Medicaid to make sure they understand how the years work. So really, I think at this time in particular, it's really about open enrollment, making sure people come in. We do know that some people who no longer qualified for Medicaid earlier this year did miss their window and did not come in and enroll during the special enrollment period that they had. And so we are encouraging anyone in that boat to enroll now during open enrollment, because it really is the last chance to enroll for 2024. If people wait if they don't have coverage now and they wait until they're sick or injured, it will be too late to enroll through Pennie. It really has to be during the open enrollment period. So that's something that, is really important to emphasize. And then we have a lot of options available to help. So here's this listed here. We have pennie.com. You can do the whole process online, but we also have lots of help available. And I'm going to turn it over to Scott to talk a little bit more about the type of help we have, and then a little bit more about how you can help us spread the word and spread information about Pennie.
All right. Thank you so very much, Devin. In the work that we do across the Commonwealth of Pennsylvania, one thing is always very clear when you start to engage in a conversation about health insurance with anyone. No one is born with an inherent knowledge of health insurance. It just doesn't happen. And it's a topic that can be challenging for a lot of people. But the important thing to know about Pennie is that we have help on several different levels. At pennie.com, our website is tailored specifically to be not only an educational resource, but an approachable, accessible resource for all Pennsylvanians. As it says, pennie.com is indeed a one-stop shop. Our shopping process is anonymous. We do not require that an individual create an account before they can answer that critical question. I know I need health insurance, but can I afford it? And at pennie.com, we can help with that. Also, as a referral resource, just like all of you, Pennie's contact center and our contact center representatives are unbiased professionals who work with residents across the Commonwealth of Pennsylvania for a singular goal, and that's to help them and their families get protected. A referral number that works wonderfully for any customer who can make a call, again, to this unbiased resource is 844-844-8040. We have both English and Spanish speaking customer service representatives, in addition to a translation service with over 240 different primary languages. Health insurance can be confusing, intimidating, especially when you're approaching it in a second language. Pennie does a lot to help people approach health insurance in their primary language and on the best footing possible. Also, I would be absolutely remiss if I didn't mention the fact that Pennie has local, local assisters and Pennie certified brokers throughout the Commonwealth of Pennsylvania. Let's face it, not everyone, not everyone likes to work online. Not everyone likes to work over the phone. Sometimes the most valuable asset is having someone in your community that you can sit down with and talk eyeball to eyeball about your needs for health insurance, about the financial savings available through Pennie, and the quality of your health insurance plan. Our assisters and brokers throughout Pennsylvania, and again, they can be searched for on pennie.com right from our homepage, or a customer can be connected with a local assister or broker through 844-844-8040. And for those who prefer to work through chat, if they are truly independent and want to approach their health insurance online through pennie.com, help is never far away. We have a chat feature, a live chat feature on pennie.com available in both English and Spanish. And that's something that we're very excited about this year to provide that additional layer of support. From an outreach perspective, I'd like to share some information with you that can help you spread the word about Pennie being an option for those, as Director Trolley has mentioned, fall into that category where they make just a little too much to qualify for medical assistance. You can follow, share Pennie's social media information. That would be a tremendous help. But more importantly, we have a toolkit that is packed full of educational materials from our toolkit and from pennie.com. You can also order free marketing and educational materials for your office. We'll send them directly to you free of charge. And thank you so much for helping us get the word out. You can also request, if you know of another organization in the community that we can help with regard to health insurance literacy or supporting their mission to help get people protected, we can perform virtual or in-person education sessions. if you know of an event that we can join you at, keep us in mind. Our team does travel, and we always welcome the opportunity to engage with communities across Pennsylvania. We also have a community partner work group that usually meets on the second Friday of every month. Those meetings are very, very important to us because we not only as an organization provide updates to our community partners, but we also receive feedback, critical feedback to help us improve our operations, to help us improve our service to the residents of Pennsylvania. And again, if there's ever any question about making a referral to Pennie, 844-844-8040 is most definitely the most direct path to help someone not only connect with the help at Pennie, the resources at Pennie, but also with local assistance in their neighborhood. So with that in mind, I'd like to turn things back over to Executive Director Trolley and just cover some highlights to remember as we move into the final push for January 1 coverage here in open enrollment and into plan year 24. Director Trolley?
Thank you, Scott. So here are just some reminders all in one page to have handy. So that is our website that Scott just walked through all of the features of that. Pennie.com, PENNIE.com. Always a good place to send people if they are just looking for some information about the marketplace and to do that quick savings calculator to see if they would qualify. And we are encouraging everyone to act during open enrollment and making sure that they know that it is the only chance to get the lowest cost on high quality coverage through Pennie for the 2024 coverage year. And the important deadline for January 1st coverage to avoid a gap in coverage or just to make sure that coverage is starting as soon as possible is this Friday, December 15th. Again, the open enrollment period does go to mid-January, but that coverage would not start until February 1st. So that does leave people uncovered for a month or more. And so we are really trying to make sure that word about the December 15th deadline is getting out. So here's the website again and the phone number for referrals to send consumers if they have any information. We really have tried to make sure that our program, no matter whether they are no longer qualify for Medicaid or maybe they're coming into us new and they provide some information that it turns out they actually do maybe qualify for Medicaid. We'll make sure they get to the right place no matter what with our no wrong door policy. And so, we really see ourselves as partners with the Medicaid program and making sure that we get as many Pennsylvanians as possible that affordable coverage. So thank you so much for your time today. If there are any questions, we'd be happy to take them. And if not, then I really appreciate everyone joining us today.
Have
And
a good
again,
day, everyone.
all right, thank you so very much. And again, we will be following up with a recording of this presentation. Um, we cannot thank you enough again for your time and for taking a moment to learn a little bit more about Pennie and our open enrollment. Thank you so much, everyone. Please be safe and have a peaceful week ahead.
Thank you. Happy holidays, everyone.
Thank you.